The risk of hip dysplasia in Australian Shepherds. Australian Shepherds, also known as Aussies, are a popular breed of dog among families and dog enthusiasts. They are well loved for their intelligence, energy, and loyalty. However, like many other breeds, Australian Shepherds are prone to certain health issues, including hip problems. Hip dysplasia is a common condition that affects the hip joint in both humans and animals. It occurs when the joint does not develop properly, leading to instability and eventually, the development of arthritis. This condition can cause pain, lameness, and difficulty in moving for affected dogs. While hip dysplasia can affect any dog breed, it is more common in large and medium-sized breeds, including Australian Shepherds. According to the Orthopaedic Foundation for Animals, OFA, Australian Shepherds have an incidence rate of 149% for hip dysplasia. This means that nearly 15% of Australian Shepherds may be affected by this condition. There are several factors that contribute to the development of hip dysplasia in Australian Shepherds. Genetics play a significant role, as the condition can be hereditary. Dogs with parents who have hip dysplasia are more likely to develop the condition themselves. Therefore, it is important to ensure that the breeding stock used to produce Australian Shepherds are certified to be free of hip dysplasia. Environmental factors also play a role in the development of hip dysplasia. Overfeeding puppies and allowing them to become overweight can put excessive stress on their developing joints, increasing the risk of hip dysplasia. It is crucial to provide a balanced diet and appropriate exercise to prevent excessive weight gain in Australian Shepherds, especially during their growth stages. Preventing hip dysplasia in Australian Shepherds involves a combination of genetic selection and proper care. Choosing a reputable breeder who screens their breeding stock for hip dysplasia can greatly reduce the chances of offspring being affected by the condition. Additionally, providing a healthy diet, regular exercise, and avoiding activities that put excessive strain on the hips can also help minimize the risk of hip dysplasia. Detecting hip dysplasia in Australian Shepherds can be done through various diagnostic methods. The most common method is radiography, in which X-rays of the hips are taken to assess the joint's condition. The Orthopaedic Foundation for Animals offers a voluntary hip dysplasia screening program, where Australian Shepherds can be evaluated and certified to be free of this condition. This can be particularly useful for breeders and potential puppy owners in making informed decisions. Treatment options for hip dysplasia in Australian Shepherds vary depending on the severity of the condition. For mild cases, management strategies such as weight control, exercise modification, and medication can help alleviate symptoms and slow down the progression of arthritis. In more severe cases, surgical interventions, such as hip replacement or joint fusion, may be necessary to improve the dog's quality of life. In conclusion, Australian Shepherds are prone to hip problems, particularly hip dysplasia. This condition can cause pain, lameness, and mobility issues for affected dogs. However, with proper care, including genetic selection, a balanced diet, and regular exercise, the risk of hip dysplasia can be minimized. It is essential for breeders and puppy owners to be aware of this health issue and take proactive measures to ensure the well-being of Australian Shepherds.